Everyone, Vasiti Uluiviti, PIHOA's Regional Lab Coordinator, and I'm based at the Guam Public Health Lab, and we'll be presenting on the Regional Lab Initiative in the US-affiliated Pacific Islands. Just an overview of my presentation. For those of you who are not really familiar with the PIHOA Regional Lab Network, and the history of it. We'll be touching on that briefly, lab capacity in the Pacific US API, and lab preparedness with regards to infectious disease surveillance. I'll touch on TB surveillance in the US API and how that is working well for us, the medical lab workforce, and of course conclude the presentation. The PIHOA Regional Lab Initiative is 12 years old. It was first established back in 2003 after PIHOA board resolution endorsed that there should be provision of core public health lab services for the US API, focusing on the listed outbreak-prone diseases, cholera, typhoid, syphilis, and so forth. And that led to a lab assessment in 2004 to identify which lab in the Northern Pacific that could provide the reference lab services. And assessors from CDC, this included Dr. Devery Houghton, California State Lab, Dr. Paul Kinsey, Hawaii State Lab Director then, and representatives from Guam and the Northern Mariana Island labs. That led to the after the assessment, it was identified that Guam Public Health Lab was the most suitable lab at that time to be able to provide these services. So in 2005, the PIHOA Regional Lab Coordinator was recruited and stationed at the Guam Public Health Lab. Our funding source has always been CDC from the beginning, through various channels. In 2005-2006, it was through the bioterrorism funds that was given to the islands, but this was discontinued in 2006. So after that, various other programs came on, and it was quite challenging. When I was, at first I did not want to apply for the job. Because I was told it was a 2-year project. So whether I was going to have a job after that, I did not know. So I took the risk. I was in American Samoa then. But it's now been 12 years old, and it's been a joyful ride, but challenging. As of 2007, 2010, and I think it was really during the pandemic, H1N1, that the influenza division and APHL came on board to help support the PIHOA Regional Lab project, and then the DLS TB, the TB contract through CDC funds, and the Association of Public Health Labs from 2011-2017, and as of now, the PIHOA CDC cooperative agreement that's in place. So thank you, CDC. We've been thankful for what we've been provided to be able to do what we have done. So for the PIHOA Regional Lab Network, it includes or involves 11 labs, and the gold-colored labs, the clear regulated labs in the U.S. flagged territories of American Samoa, CNMI, and Guam Public Health Lab. The American Samoa Department of Health Lab is clear-waived, and the other labs in the freely associated states in Palau, Chuk, Ponape, Koshrai, and Yap of the FSM states, and RMI labs of Ibai and Majuro are non-regulated. And it's important to note at this point that except for Guam Public Health Lab, all other provide both public health and clinical lab services. Whatever I'm highlighting from this slide onwards, really what's been done in the last few years since 2015, even though there had been activities going on from the beginning. And right now, the focus of lab strengthening, especially in the area of lab quality management systems, began in 2010 of April when PIHOA board endorsed the resolution concerning lab strengthening among PIHOA member states. And this was in response to WHO's endorsement of another a strategy of strengthening health lab services 2010 and 2015. But we did not really begin our lab quality lab strengthening till 2015 through the provision of ESTO funds. So in 2015 till January of 2017, we have been able to provide on-site LQMS training, lab quality management system training, to all of the labs in the US API. And this included 12 modules of the quality system essentials. At the same time, draft lab quality manuals were developed for each of those labs. And since December of 2016, we were able to pilot SLAMTA in the US API. For those of you who are not familiar with SLAMTA, it is called Strengthening Lab Management Towards Accreditation. This is a CDC initiative through PEPFAR funds in the African countries. But PIHOA was able to get into one of the training of trainers in Johannesburg in South Africa in early 2016. So Yap learned about this. The US API labs, health directors learned about this. So Yap was the one who volunteered to pilot this initiative. So we began the initial audit in December of 2016, and the first SLAMTA workshop was completed the last week of July of this year. SLIPTA stands for Stepwise Lab Improvement Process towards accreditation. And after conducting the lab audit, findings and recommendations were presented to the YAP Department of Health. And we were fortunate to put YAP on the map, on the world map, to be the first Pacific Island lab venturing out to try out SLAMTA in the Pacific region. So we were able to go on this year's January newsletter. So in addition to the capacity building in the US API, forgot to include two other activities that happened this year. One was the sending a YAP lab staff down to the LBJ Tropical Medical Center lab in American Samoa to attach for 4 weeks. All they did was bench work. And why the choice of American Samoa? They were a willing partner in this initiative. It's a clear regulated lab, and with a high workload and quality work that required performing activities or lab work that was in compliance with the clear regulations, which is why we sent lab folks down to American Samoa. So the outcome of that, they're wanting to send another lab person from YAP to go attach because they found it very helpful and were learning a lot, especially with the high workload at the LBJ Tropical Medical Center. And the other area was during the implementation or delivery of the LQMS training on-site in the islands, one of the YAP lab supervisors was willing to help the PIHOA Regional Lab Coordinator also deliver training in the other islands. So that was a great help. With respect to infectious disease surveillance, public health, and lab preparedness in the USAPI, for your background information, there is limited infectious disease testing capabilities in the islands. For bacteriology testing capacity, this is only available, though limited, at the LBJ Tropical Medical Center in American Samoa and the Commonwealth Health Lab in Commonwealth of the Northern Mariana Islands. And for most cases, we would refer our specimens to the Hawaii State Lab that does almost all types of testing, and even to the Guam Public Health Lab. So since 2006 to 2015, PIHOA has been the sole provider of the IATA dangerous goods training for the shippers. And since 2016 May, we had the first training of trainers for shippers in the USAPI. And as of today, there are 61 currently certified shippers in the USAPI, and this is, if you compare this to the 25 trained shippers back in 2005. So with more trainers now trained and they're on island, they can be trained anytime they would like to, since the availability of the trainers are right there. So the training had a 90% pass rate. Now there's availability of a DGR trainer on island. There are shipping protocols that we have developed that was tailor-made for the USAPI to the type of specimens that needed to be shipped and to which reference lab it needed to be shipped to. And we have also developed a training competency checklist that could be used by the trainers that had both theory and practical components. That is just a picture of what happened during our training of trainers training in Guam last year. Specimen transport in the USAPI. Prior to 2015, this was very challenging. Just shipping off samples for reference lab testing, especially during an outbreak, PIHOA would pay up front, and just seeking reimbursements for those, the cost of the shipments was very laborious, cumbersome task. But as of March 2015, the PIHOA board endorsed this resolution to be able to support lab preparedness among the PIHOA member states to support shipping Ebola and or highly infectious disease specimens for reference lab public health lab testing or other emergent outbreak or situations. And this involved injecting $3,000 annually to the PIHOA Lab Revolving Fund, mainly for that purpose, to support the shipping costs. And to date, the islands have continued to replenish the fund, and it just shows the effective use of the PIHOA shipping mechanism. And just an overview of the type of specimen test that's needed and where we ship to using the PIHOA shipping mechanism. As you can see, Guam Public Health Lab, in Guam, Hawaii, US mainland, we have gone as far as Puerto Rico, New Caledonia, and even Melbourne down in Australia. And just the geographical overview of where we have shipped. And this has been the highlight, I believe, for the Zika outbreak. Without this shipping mechanism, we wouldn't have been able to ship those many specimens to Hawaii State Lab and to even as far as Fort Collins, Colorado. The PIHOA shipping mechanism involves the shippers letting me know that they are wanting to use the PIHOA revolving fund, and that is important because they need to let me know of the airway bill number of whatever the shipment that they have shipped. And when the invoice comes in, I need to verify that, yes, it really came from Palau. It really came, that shipment came from Majuro in the Marshall Islands. And this is, the invoices are verified, and we draw down from their contribution in the PIHOA revolving fund to pay the shipping cost. Guam Public Health Lab has shown impressive progress in their effort to be able to become that Northern Pacific Regional Reference Lab. And as a collaborative partnership with the Pacific community, we were able to conduct a one-year-long training to enhance their diagnostic microbiology and skill-up training. As a result of that, they have been able to re-establish their Neisseria gonorrhea culture capacity. For your information, Guam Public Health Lab was suspended by CLIA back in 2006 because of their many deficiencies in bacteriology. So they have been able to reestablish N. gonorrhea culture, and the establishment of the other bacterial culture capacity, focusing on typhoid, cholera, shigellosis, and other waterborne infections in food, still in progress. And this just listing here the various progress that they have been able to make since 2003 when they started on this journey. And lab testing using the ABI 7500 PCR, influenza subtyping H1, H3, and H5. They have that gene expert influenza as well. They're able to do trioplex testing for Zika, dengue, and chikungunya. And just in April, they had 100% pass in the CDC 2017 arbovirus proficiency survey. They hired the lab administrator in Jan 2016. April of 2017, they were able to hire a microbiologist, but I know there are a few more positions that need to be filled. And so far, some islands in FSM and the CNMI labs are sending specimens there for testing for Zika, dengue, and chikungunya. just a picture of that microbiology enhancement training at Guam Public Health Lab, and they got certificates.
Please mute your phone.
Training ended in October of last year. So what I would like to re-emphasize and highlight here that in the event that Hawaii State Lab would not be able to help us in the islands to test our specimens, that we have this, the next alternative, and the best alternative is Guam Public Health Lab, because they're right there in the background, that they could help us immediately. So they have shown that they have the capability to test specimens from the other islands. And just at the end of May, the Hawaii State Lab faculty were able to come down during the PIHOA 5th Lab Network meeting to conduct 2 days of biosafety training. It's the first time ever that this has happened in the USAPI, and they're planning another follow-up training in November of 2017. TB surveillance in the USAPI. On this slide, I would just like to show what happens at the level 1 labs. What happened? Okay. At the level 1 labs, all of the labs do AFB smear, direct, and gene expert testing. So after that, they ship off specimens to the diagnostic lab services in Honolulu, Hawaii, for culture and antimicrobacterial susceptibility testing. And if it is needed, specimens are referred by DLS to the microbacteriology lab here in CDC, Atlanta. So that's an overview of what happens. And this next slide, this is one of the areas that's I know is strong in the islands. We have 3 types of external quality assessment going on: the blind slide rechecking, the acid-fast bacilli proficiency testing panels, and the on-site visits that I do, because DLS has subcontracted PIHOA to be able to do that. So with all that going on, there is great teamwork going on with the TB USAPI National TB Program. That collaboration among partners, DLS, CDC, WHO, and that communication and teamwork that's going on between among lab, the programs, the nurses, the doctors, the TB physicians. It's a model of success that has been, I think I would say, since 2005 when I came on board, and it has even gotten stronger, and I'm glad that Derek Felix is here. I think the USAPI, I believe that, and I'm confident to say that the national TB programs in the islands is just getting stronger. And we are thankful to CDC for their great contribution and in support with that. And with our TB specimen transport, the increased EQA participation with improved scores, and now, previously we would not show names of the labs. As of this year, we have planned that we will show the name of the labs. There's no more secretive things going on. So when we did that, they were like competing against each other because they wanted to be better than the next lab. So that's going well. The ongoing training provided by CDC, and for my going on site with regards to gene expert training, the training of TB lab tech support, the backup, whenever the TB, the primary person goes away or is absent, there's always someone there to do the job. The timely reports that come out every quarter, they are very efficient with that. And of course, our ongoing communication. DLS, PIHOA, WHO, and CDC, we have monthly conference calls. So effective communication is very important, and everyone is aware what's going on where in the islands. So I hope that, that the other federal programs, public health programs, could mimic TB, because it's a working model in the Pacific, in the USAPI. The medical lab workforce, this is a challenge for us, because especially in the freely associated states of FSM, Palau, and RMI, we have very little number of people with degrees in the medical lab science field. There is lack of expertise in clinical microbiology across the USAPI. And we are hoping that this initiative we did back in 2011, 2012, just by advocating or promoting the medical lab profession happens again. It was something, it was an eye-opener for the college students, high school students, because all they thought that when you go into the medical field or into the hospital, you'll only see nurses and doctors, when there are other medical professions out there. So in summary, we have a lot of challenges. As Amy had highlighted earlier, our diversity, the different languages, the lifestyle, the needs, the policies, the different policies, government policies in the different governments, the limited lab capacities that we have, especially the weak diagnostic microbiology capacities, the infrequent flights to and from the islands, equipment breakdowns. We don't have enough biomedical engineers. So if an lab equipment breaks down, it's going to wait 3-4 weeks, maybe months before it can be repaired. The inadequate lab quality management system, there are no quality champions. Once you can identify one, it's easy to work with them. So at this point, I am hoping with that SLAMTA initiative that at least 2 labs, probably Yap and Palau, will go towards accreditation a few years down the road. Medical lab workforce shortage, as I had earlier mentioned, and of course financial limitations. I think this is not uncommon. The unfunded, neglected tropical diseases, you know, I hope now that with that Zika, the outbreaks that we had, maybe leptospirosis. Leptospirosis is there with us, but it seems to be neglected. So despite the challenges, things have worked for us, and we are hoping that CDC will continue to help sustain whatever we have established, and to further enhance and sustain whatever we were able to do with the resources you have given us. Thank you.